Hello, I'm James Townsend with wellwise.org. I'm here at Natural Products Expo West with Dr. Jay Udani. He is the CEO of Medicus Research and an assistant clinical professor at UCLA. Been involved for many, many years with integrative health practices and research into nutrients and nutraceuticals. Welcome.
Thank you for having me.
Joining us. I think the first question I'd like to ask you is, what do you think is the most pressing health need that we have in this country today, and how might nutrition or nutraceuticals and supplements address some of these needs, or one of them?
Based on our research and presentations that we've put together and worked with others, I think that the general obesity epidemic is the largest health need of our country and soon to be the rest of the world.
Right.
Obesity and the concurrent metabolic diseases of diabetes and cardiovascular disease are really all tied together. And the economic costs, not to mention the health costs of that, are soon to outstrip all the health care that we have.
Exactly. And are you seeing promising possibilities in addressing these through nutrition and supplementation and that sort of thing?
We're seeing some really innovative ways to approach this. It's no longer fault finding or pointing fingers at someone for being lazy. It's really recognizing what has changed in their physiology that has brought this on. There are marketing forces, there are scientific forces, there are social forces, and all three of them are being addressed. So for example, in dietary supplements, we can look at ways to increase metabolism. We can look at ways to block the absorption of certain nutrients. We can also look at functional foods, of finding foods that help people feel full longer to help them reduce the total number of calories that they take in, and also looking for foods which are less calorie dense options than others. And then finally there's behavioral management. These supplements and foods don't really stand on their own. They have to be wrapped together with some sort of behavioral management program, whether it's an online course or with their physician or a dietitian, but these are growing, and this is really where the opportunity is.
Let me ask you specifically, in the satiety field, or that which makes people feel more full when they've eaten something, what things in particular have you been looking into that are helping in that area, that are actually working?
There are various forms of fiber, which essentially are filling because of the space that they take up or the expansion. There are several other supplements which are being tested now or marketed and soon to be tested, but a lot of them still require more evidence before they can be recommended.
Mm-hmm. I see. And is there any particular thing that you have found that right now that you're really passionate about, that you're excited about in the nutritional field that is working?
There's a lot of potential out there. There's not one particular ingredient that makes me jump up and down. What I am excited about, however, is that more of the ingredient companies are investing in good quality science. There's a lot of claims that always go the cart before the horse, but at least a lot of these companies are now starting to back that up by saying, look, we have foundational science, which is preclinical or animal. Then we have human clinical studies, initially small pilot studies, and now larger studies. And what's important is a lot of them are being done in the right population. Sometimes the population is not relevant to the U.S. consumer. A large study done in certain parts of the world may not have the same genetic components or underlying dietary problems that we have here in the U.S., and so those studies do need to be validated here in the U.S.
So in other words, something that was done on a Japanese population or an Asian population or an African population may not be valid in a population that's predominantly Caucasian?
It may not be applicable. One example I like to give is some of the early fish oil studies were done in Norwegian fishermen and the omega-3s that they consumed, and that was very valuable information, but I can't necessarily apply that to an inner city urban population here in the United States. They're going to have different genetics, they're going to have different lifestyle, they're going to have different socioeconomic issues that change the way that they react to certain ingredients.
Well, in that arena then, what about testing, some sort of assay or things that will help people to understand what is needed specifically for them, genomically or whatever? Are there things that are coming up on this that are interesting?
It's very interesting, the field of this genetic testing and looking for, what are the metabolomics or genomics that are particular to you as an individual that would drive what you need. I think that all those are still also very early in their development. I think that in my clinical experience, when we were using some of those tests, they all basically said about the same, which is eat less, exercise more, eat less fat. You know, going further, if refined from that, yes, of course, you'll have certain risks that other people in the population may not have, but those tests are still very early in their development at this point.
I see.